Hey guys, how's it going? Yeah, real quick discussion about incidentalomas. Have you guys heard of that? Just exactly like what the word says. Incidentaloma, it means it's incidental. And then oma, it ends with oma, like fibroma, myoma, sarcoma, like that. It means it's a growth. But then incidental, that means that it is incidental. So it's a growth that is just found out incidentally. The reason why we have to discuss about this is nowadays, you can go online to various websites and you can order your own lab tests. You can pretty much order whatever you want to order. You can order men's health, women's health, testosterone level, hemoglobin A1C, all kinds of stuff. And then now it also includes all kind of radiology. These are all patient driven. The patient just orders it himself. So you can order a CAT scan of your brain, MRI of the brain, CAT scan of the chest, abdomen. So all kind of stuff. And so this is new to healthcare, where a patient can order whatever that they want to order. They can add it to the shopping cart, like as though adding something to Amazon shopping cart, and just pay the money and then take the slip and go get that done in a local radiology shop. So then what happens is you end up coming across these kinds of things, incidentalomas, where they end up reporting a little bit of a growth, like small, growth found on adrenal gland. So then it is incidental because you didn't expect that it would be there. So it's an incidentaloma. And then many of the radiologists would exactly use that word, incidentaloma. They'll say like incidentaloma found. And then what are you going to now do about it? Does it mean that it's a cancer? Does it mean that it's just benign? So then what happens is it scares the mind. And then a lot of these patients would have to go back again and get the scan repeated in 3 months to see if it's growing now. And if it's growing, then the next step is to go do a biopsy to look at the tissue under the microscope to see if it's cancer. Because both benign tumors would grow and then cancers would go. And then, of course, cancers, they grow real fast. And then they not only locally grow, but they go to other organs. They kind of spread. But then benign tumors would be slowly growing in that area. So incidentalomas can sometimes be stable where they don't grow at all. They're just stable. 1 year later, when you do another scan, it shows that it's just stable without much of a growth. Then that would reassure the patient. But if it's growing, it's a problem. So that's why, guys, we got to be careful before ordering tests on our own and getting it all done online. So incidentaloma is one example where it can really worry your mind and then cause permanent fear in your mind that maybe there's some kind of a cancer lurking in your body. I'll talk to you later in my next post, guys. Goodbye.